Well, good afternoon, everybody. President Trump will be speaking on the coronavirus, I think, at 6 o'clock this evening. But I just wanted you to know what we've been doing here in the state of Connecticut. Yesterday, the CDC, Center for Disease Control, upped the ante to the degree to which they said we've moved from a position of containment of the virus to mitigation. And that means we've got to be ready for the fact that it could be coming to our shores in a more aggressive way. And I want you to know that here, meeting with the Unified Command, all of our healthcare professionals, talking today with all of the folks from the hospitals to our DEEP to all of our different commissioners, Connecticut is ready. And we've been ready for a while. It was just last August that we did a test right here at the Operations Center, ready for the possibility of a pandemic. What this means in terms of a unified command is you've got state government working together on a coordinated basis and making sure we can provide all the support we can for our hospitals and our healthcare providers, making sure that they're ready to get all the supplies and personnel they need depending on what could happen going forward. This thing is breaking fast. You probably know was really just detected a couple of months ago, found out that there was person-to-person contact contagion just a month ago. And we've been meeting on this every day. Our Commissioner of Public Health is down in Washington, D.C. right now, and we're doing this on a very coordinated basis. But you should know that things are changing on a daily basis. So I want you to know that you can always go to ct.gov, ct.gov. We have all the information related to schools, related to public health, related to everything we're getting from the hospitals, related to CDC in one place. And I think that's important in terms of what you need to get for real-time information going forward. I want you to know, look, there's been one infection here in New England so far, none in the state of Connecticut. This is not a call to make you nervous. It's a call to give you confidence that we're ready for what's going forward here. Give you confidence that we've got the best people here in the state of Connecticut who have been on this, not just today, but for weeks going forward. One of those people I'd like to introduce right now is Matt Carter. He's our state epidemiologist. He's on top of the healthcare side of this. I'd like to have him say a few words.
Good afternoon. As you know, we've been, as a country, working on containment since mid-January. Containment means trying to keep this new coronavirus out of the United States. But those of us who work in public health and infectious diseases know that these measures that we've been using, monitoring travelers, for example, would only slow things down. They won't stop the spread of the virus. Not a virus that's easily transmitted from person to person, like we're now dealing with. We're also concerned that we're dealing with a virus for which there is no vaccine, and there will not be a vaccine probably for at least a year. You'll hear lots of stories in the media about vaccines under development, but that's going to take time. There's also no approved antiviral medication that is approved for use with this virus. As you know, we have such a thing for flu and for other viral diseases, but at this point in time, there's no medicine that you can take to make this virus go away. So what's ahead is challenging, and what's happened in the past few days is really a change in focus, acknowledging the spread that it's occurred in the past week. Suddenly we have it in Iran, in Europe, in Italy. Cases are being diagnosed in other European countries. We have cases in South Korea and Japan. First U.S. serviceman in Korea was diagnosed today. So things are moving quite rapidly. But we now have a window of opportunity to get ready for transmission that could occur here. And that process is called community mitigation, trying to slow this thing down, prepare the medical system so that we can handle anyone who gets sick, and we can take care of our people, and try to reduce what's called, the number of people who get sick or even die if this arrives here. It's no good pretending that it's not going to come. I think the old saying is better to prepare for the worst and hope for the best. And right now, it's time to prepare.
Commissioner Rovella, would you like to say something?
Thank you, Governor. Dr. Carver, thank you. James ROVELLA, Commissioner of Emergency Services and Public Protection. I'm also the Homeland Security Advisor to the Governor of the State of Connecticut. So, ladies and gentlemen, let me first tell you, this isn't a sprint. This is a marathon, and this marathon needs a lot of preparation, which has already been taking place, and it's going to run for a while, isn't it? We don't have an end date set for it yet, but we initiated our pre-activation procedures in January 27th of 2020. And what that means is our Emergency Operations Center went from monitoring to enhanced monitoring. Together with DPH, we were initial weekly coordination telephone calls, monitoring the situation. And DPH is the lead in this. We are the backbone for the agency. Those numerous phone calls have also included the Department of Homeland Security, the National Governors Association, and we moved to the Web EOC, which is an incident-based management, and we've titled that, and that is available to our state municipal leadership and to our first responders. Our public coordination, the governor mentioned CT.gov. It actually points you to different resources that are out there and available, and also to the CDC. State agency continuity of operations plans, our COOP plans. The entire state has a COOP plan, and each and every agency has a COOP plan which they have developed for the continuity of our business operations for the state of Connecticut. So we do not go down. We are always available for our citizens out there. The governor mentioned a pre-planning or preparation. The legal staff has met with DESPA legal staff and the Department of Public Health, and they're talking about emergency plans and preparations. Exercises. Last August, we participated in a nationwide pandemic plan. So we actually have planned for these things, and we exercise all the time. And that's part of this marathon of preparing for the inevitable. We implemented plans that we've exercised for years. So have confidence in us. We'll get everybody through this. It'll be a huge team effort, and information is knowledge, and we'll push out as much information as possibly can. Thank you, sir.
Thanks, Jim. Jennifer, on behalf of the hospital, would you like to say something?
Yes, thank you. I'm Jennifer Jackson. I'm CEO of the Connecticut Hospital Association, and we represent the state's hospitals. And I'd like to thank the governor and his administration for all of the work that they've done to prepare, and to echo what the governor said, that we are prepared in Connecticut. And I want the public to be assured that hospitals are prepared to care for patients with COVID-19. This is what hospitals do. We regularly prepare, we plan, we train for outbreaks of disease. We have built resiliency into our system. We have experience preparing for Ebola, for H1N1, and every year for the flu. We've been working in partnership, as was mentioned before, with the Department of Public Health and other state agencies. We continually update on a daily basis, on an hourly basis, update the information as we learn more about COVID-19. And we are, as Dr. Carter talked about, we do expect and we are ready for patients to present to the hospitals. We will identify them, we will isolate them, and we will treat them. We are prepared to care for these patients.
Any questions?
A letter today, I guess, from the president of the Connecticut Emergency Management Association concerned about a lack of protective equipment. Can you address that?
Look, I can tell you, you can talk to Jennifer. Right now, given the nature of this pandemic overseas, when it comes to protective equipment like face masks and the such, there's a scramble. But obviously our hospitals are ready. They've got a supply right now. And Jennifer and the rest of the team is outsourcing other protective equipment wherever we can find it. That's true of every state in the country.
And are you getting enough federal support? Is there enough communication, and are you getting enough federal funding for what you need? Is there federal funding that we need?
That's what our public health commissioner is doing down in Washington right now, talking to our congressional delegation and federal leaders.
What are you getting in terms of communications from the Trump administration?
We're in hourly communication with CDC. This thing is breaking so fast right now. They're catching up. I think right now I feel like Connecticut's a little ahead of the game in terms of our preparation going forward. But we're trying to coordinate them with as best we can so we can track where this virus may be and be prepared.
Governor Cuomo had been asking today, he came out seeking $40 million for things like masks and gloves. Are you seeking any money, or do you need extra money from the legislature, or what is the status of that?
We're down talking to our delegation right now about that. Obviously, there's going to be a federal grant that will be coming. I think they're finalizing that right now. Make sure Connecticut not only has its share of that, but making sure with each and every one of the people here that money's going to the most appropriate uses.
Jennifer, some of the smaller hospitals, like if a patient, would they be directed to a larger, or can the smaller do the same thing?
All hospitals are prepared to care for these patients. I mean, obviously, the hospitals work collectively depending on the level of severity for patients as any disease progresses, and share and coordinate resources, but all hospitals are able to detect, isolate, and begin treatment for any COVID-19 patient.
And go ahead, sir.
Governor, can you talk a little bit about how you're coordinating with municipalities, local agencies, local health districts?
Yeah, we're in regular contact with each and every one of them, starting with public health. They've been in regular contact going back weeks, updating them in terms of protocols, what we should do, getting them linked back to ct.gov. We're doing the same thing with the schools, as you can figure out. We try and figure out, make sure we have the right protocols there as well. I think the lines of communication, starting right here at the EOC, give me a lot of confidence that that's happening.
Can you give a little bit of detail on what some of those protocols are? The schools, for example?
Want to talk to that?
Matt Carter.
As you may be aware, the Centers for Disease Control and Prevention has developed protocols for almost every scenario: workplaces, schools, acute care hospitals, outpatient settings, etc. We have shared those with our partners, with the Department of Education specifically. We provided them with initial guidelines, which was basically about travelers, students from other countries who are attending schools. Last Friday, the State Department of Education sent an email out to all of the school superintendents and principals with guidelines for workplace preparedness and also pandemic planning. So the guidelines are actually there. You can't just take your pandemic plan from 2007 and make it work for this. But there's a lot of guidance that's already been developed and is already in place.
Mr. Governor, how concerned are you, and how concerned are other governors you speak to about what's been described as a level of incompetence at the White House and the fact that President Trump has hollowed out a lot of the structure for whatever reason that President Obama's team had put together?
We had the Governors Association meeting down in Washington, D.C. 10 days ago. We had CDC and FDA and others came and gave us a very preliminary briefing on what they saw coming out of Washington, D.C. Frankly, to tell you the truth, they're asking us a lot of questions, what we saw at the state level and what we see in terms of detection going forward. Tell you the truth, I think they got some catching up to do. I think we all do. But I feel very good here in Connecticut with the people that we've been planning for this for some time.
Have you gotten feedback from the delegation on the money, or do you expect this 6 o'clock announcement to outline the amount of money we're talking here?
Let me get back to you on that. I think that's a moving target, Chris, but I can tell you we're on top of that. Our team is there. Rose obviously is in the committee that's relevant to this. So we're going to get more than our fair share.
Governor, a number of universities are considering whether to recall students who are studying abroad, but they seem to be doing so independently. Is there any effort to coordinate their efforts?
I could probably ask Dr. Carter, maybe you could speak to that. I think probably it's a little premature for us to be dictating there, but let me ask the epidemiologist.
Well, right now we're asking people to follow the CDC travel advisories. There's different levels. And what's remarkable about the current situation is these levels are changing day by day. There's a level 1 advisory, a level 2, and a level 3. Level 3 is the one that's now in place for Korea and for China, which is non-essential travel is not recommended. Level 2 is asking people to take special precautions. That now applies to Italy as well. I think what we're going to see is a lot of changes in that list over the next week. As we see additional transmission in Europe occurring and occurring in other countries. So really, people need to check those websites every day to see what the CDC is recommending in terms of travel advisories. We know that already in Connecticut, there have been discussions about not recommending travel to any country that is already at a level 2. So things are really progressing. Again, it's only been 6 or 7 days that we've seen this transmission rapidly spreading into parts of the world where it was not in January and early February.
Based on our past experience with Ebola, I believe there were 8 folks quarantined in 2014 in SARS. I mean, is there any way of gauging what the potential number of cases that Connecticut could be looking at this point, or is that something that you really can't forecast?
Well, one, this is very different from Ebola, and the way it's transmitted is very different. And there are very few lessons from 2014 that apply here. This is most likely going to be, it's a respiratory illness. You can't really tell the difference between the illness for this and influenza just by looking at symptoms. The way I'm currently thinking about it is most likely it is probably going to be at least like a really bad flu year, but with no vaccine and no antivirals. That would be, I think, a reasonable planning target at the present time.
Regarding the Connecticut Emergency Management Association's letter, one of the suggestions that they had was to suspend temporarily fit testing for N95 particle masks. Is that something that you would recommend doing at this point or consider?
CDC has already issued national recommendations for conserving masks, and that's what we're asking people to follow.
Is there anything people can do to stay healthy on their own right now?
Well, this is wash your hands is part of the message, but I think really there'll be a series of messages that come out. I mean, certainly this is transmitted from person to person. We're not yet at a point because we don't have ongoing community transmission. There'll be other social distancing measures that come into play later on. You may have read about asking people to stand 6 feet apart, canceling large group gatherings. These kinds of activities may well be recommended and something that we've actually never seen in the 35 years that I've been here.
Has there been any, Governor, has there been any consultations with the Judicial Department regarding how they might handle cases if there comes to be, orders by local health department or the state commissioner of public health to isolate or quarantine?
Yes, our general counsel has had a number of conversations, both in Washington, D.C. and related people here, seeing exactly what we can and can't do. I just say generally in closing that we're moving in the unknown a little bit. This thing is moving really, really fast. And I want you to feel confident that we're doing everything we can with a group of professionals standing with us today, that we've been on this for a while, paying attention, and I think Connecticut's going to be able to take the lead to give you confidence we're doing everything we can do to keep your kids safe. Thanks, everybody.